Hey there, folks. Good afternoon. Hope you are doing well. I'm Myra Ansari here for Wave Now. Today, we are talking about Colon Cancer Awareness Month. And we are in March, so we want to talk about this very important topic. So today, we are teaming up with Dr. William Evans with Norton Healthcare to talk about colon cancer, what folks need to know about. One of those things that, I think we can't talk enough about, Dr. Evans. What do you want folks to know about today in our conversation?
Well, first of all, thank you for having me on, Myra. March is Colon Cancer Awareness Month. So I think the biggest thing I'd want people to know is to try to learn more about colon cancer and really reach out to their family members and find out who has had a history of colon cancer in their family or have had precancerous colon polyps in their family to see if they're at high risk. And if they could be at high risk with a family history, they would want to contact Norton Healthcare or their primary care providers to talk more about screening for colon cancer, even at a younger age, under the age of 40 or 45.
Let's talk about the screening age. What is now the standard for folks? When should people start making that appointment?
Good question. With patients who do not have a family history of colon cancer and do not have a family history of colon polyps, especially in their mom, dad, brother, or sister, the recommended age to start screening is age 45. And that was lowered back in 2018 from age 50 because we're seeing colon cancer in younger folks.
And why is that?
It is speculated lifestyle is going to be the biggest contributor. It's recommended that we ingest about 25 grams of fiber in our diet a day through fruits and vegetables. And Americans only take in an average of 10 to 15 grams per day. So low fiber diet, ultra processed foods and meats are thought to contribute to this early young onset of colon cancer. Decreased physical activity and exercise, too much alcohol, and smoking tobacco is also one of those other contributors. There are other things in the environment that people cannot, or researchers can't put their finger on, but environmental factors, whether it's stuff in the soil or water, might also be playing a role. But as far as patients go, it's those things that I mentioned that they could somewhat alter.
Let's talk about signs and symptoms. Are there some obvious signs that something's not right?
Great question. So colon cancer starts from colon polyps, and colon polyps are small abnormal growths to the colon wall. When a patient has polyps, they have no symptoms whatsoever. A polyp, once it can be seen visibly on a procedure called a colonoscopy, once you can visibly see a polyp, you have approximately 8 to 12 years before that polyp can continue to grow and form to a cancer. For younger folks, the main symptoms that something might be going on are blood in their bowel movements or bleeding with bowel movements. Chronic abdominal pain. If they're a patient who hasn't had any sorts of problems with their GI tract before, but they're noticing this ongoing pain that keeps cropping up and doesn't subside. And then the last thing is going to be change in stool caliber or change in bowel habit.
What's surprised you? Has anything surprised you in your career, in your time in medicine when it comes to colon cancer? Have you seen someone extremely young dealing with this that you thought, wow, or a case of, thank goodness we did this, this screening just in time? Can you share any stories?
Yes, unfortunately, it is in my specialty. I take care of a lot of patients who have already been diagnosed with colon cancer and complications associated with it. The colon cancer is spread and they have stage 4 metastatic disease. The biggest surprise is that the age that patients are being diagnosed is getting younger. And it's not just what I'm seeing, but actually in January of this year, the Journal of American Medical Association, came out with a very surprising article that colon cancer is now the #1 cause of cancer-related death in those under the age of 50. So when they looked at patients under the age of 50 since the 1990s, we've had a decrease in cancer deaths by 44% for all cancers like breast, leukemia, etc., but not colon cancer. Colon cancer has risen 1.1% since then. And so it is now higher than breast cancer as a cause of cancer-related death in those under 50. So it's this ongoing trend because of lifestyle, because of environment, that we're seeing colon cancer younger and younger.
So do you think that one day, I know that you said that this, the age it went from 50 to 45, we're trending in this direction. Do you see 20, 30 years down the road that we start screening sooner?
I think we will, yes. But instead of waiting until we get those recommendations or more data is coming out, I think the message would be for patients to, again, like I said, talk to their family. And if their family members, especially first-degree relatives, mom, dad, brother, sister, even grandparents, aunts, and uncles, if they've had colon polyps, to try to find out at what age they were diagnosed with those polyps, how many they had, maybe what size they are. I know that's a lot to get, but the more detail you have, what that does is it gives information to even somebody in their late 20s, in their 30s. Hey, I've had family members with polyps. Well, if that's the case, then we would think about screening you early, way before the age of 45.
If you have a question, folks, for Dr. Evans, please put it here in the chat. And if I see it in time, I will try to get it over to him if it's related to colon cancer so we can get your questions answered. All right. Another big thing to talk about with this topic, Dr. Evans, is screening. Colonoscopy,
Yes.
of course, but there are other options. But what do you want people to know about the importance of screening?
That's a great question. So the first thing is that there are options for screening. I think a lot of people think that colonoscopy is the only way that we can screen for colon cancer, and it is not. And I think that sends a lot of people in the other direction because there's an embarrassment factor with colonoscopy. It's a procedure that requires sedation. With that, you have to take off work, and there can be some expenses to that associated with taking off time from work. So there are other options. The options are stool-based screening. So these are advantageous because you can do these at home in the privacy of your own home. So that would be the biggest thing, that there are options. The other barriers to screening, I think, are mostly related to, I think a lot of people view colon cancer as this is something old people get. I'm in my 30s. I don't need to worry about that until age 45. And the data is showing that's completely untrue. We need to worry about it now, especially talking to people in their mid to late 20s. And the last thing is that I think people think, well, what will be, will be. If I'm destined to get colon cancer, well, so be it. There's nothing I can do about it. I might as well live my life. And that's the sad part, that colon cancer is preventable. And if we can identify people at high risk, and then we can screen the people who are average risk, screening can decrease the incidence of colon cancer by up to 75%.
Let's talk about the prep that goes into a colonoscopy, because I think the thought of that also makes people, think twice about it. But
Yes.
Walk me through, what is the prep like and what it entails?
Great question. So first of all, you only need to take one day off of work, and that is for the procedure itself. The prep can be started the day before in the evening. The prep, what we have patients do is eat a very light breakfast the day before their colonoscopy. And then for lunch and dinner, they're on a clear liquid diet. That evening when they go home, they're going to start their prep. Recently this year, Kentucky state law called House Bill 421 made preps that are prescription based, that are smaller volume preps, meaning they're only 12 to 16 ounces of prep followed by multiple glasses of water, lemonade, Gatorade, etc. They made those available to the public without insurance having to charge a copay. Now, this is not uniform over everybody's insurance, but there are some that can receive these really good small volume preps without having to pay a copay. But essentially, that evening, you start your prep, you wash down your prep, you go to sleep for a few hours, and then we set your alarm clock in the middle of the night to go about 5 hours before your test. We're going to have you wake up and take your second dose of prep. Again, you'll go to the bathroom, and then you'll be ready to go for your colonoscopy.
All right. Go ahead, please.
No, I was going to say, there is a lot involved in there. However, the benefit is for an average risk patient that has a colonoscopy and they have no polyps with a good prep, they don't need a repeat test for 10 years. So that's one of the advantages of doing a colonoscopy.
Versus, that's kind of like what I hear is the gold standard, right? Doing the colonoscopy versus doing the at home, or of course, doing nothing at all.
Right. So the at-home tests anything's better than nothing. So the at-home tests, the disadvantage that if you have an at-home test that is positive, you will have to do a colonoscopy. And the other somewhat disadvantage is we want these stool tests done either every year or every 3 years based on the test. So you're going to keep doing testing. It's more frequent than you would a colonoscopy. For patients who are high risk, meaning they've had a first-degree relative with colon cancer or polyps, or multiple second-degree relatives, aunts, uncles, grandparents, cousins that have polyps or colon cancer, we would recommend more for a colonoscopy as the screening test to avoid the stool-based test, just for the high risk.
Talk to me a little bit about, lifestyle changes. Okay, I get diagnosed with colon cancer. What can I do, or what are things that I can do before to lower my risk?
Great question. So right now, I'm trying to eat more fruits and vegetables, intake more fiber in your diet, try to avoid highly processed foods, ultra processed foods. And I think a lot of processed meats, we want to try to make our own food at home, tending to eat more white meats, pork, fish, and chicken over our red meats. Limit our alcohol consumption. We don't want to drink to excess too often. Try to get a lot of exercise, stay active. And again, that'll help combat overweight and obesity. And then just like with any other cancer, cigarette smoking is going to increase your risk. So encourage those that have difficulty with cigarette smoking to look into a way to stop it with nicotine replacement, et cetera.
Are there certain demographics that are more at risk, Dr. Evans, than others?
Yes, patients in lower socioeconomic areas and immigrants and minorities. And again, why is that? Lack of insurance, lack of availability for a primary care physician, education levels fall into that. Kentucky does have free colon cancer screening for uninsured patients. We have that through the Kentucky Committee of Colon Cancer Screening and Prevention. So there is a way for people who are in any area to obtain colon cancer screening.
What recent advancements have just blown you away that you want to share with folks?
For colon cancer screening, I think the biggest one is our stool tests are getting better, the technology. So every test we do in medicine, there's going to have some that are falsely positive, meaning the test shows a positive result, but there's not one there, or a false negative result, meaning, hey, the test was normal, but there is something there. And we have new stool tests that do not look at DNA, but RNA, so they're a little bit better. We have a blood test that is now available trying to pick up on colon polyps to see if somebody needs colon cancer, which is part of just a blood draw. That test is FDA approved, but it hasn't been endorsed by, I believe, the United States Multi-Society Task Force of Colon Cancer Screening or the American Cancer Society. But those things in themselves are exciting, that we are getting to a place where hopefully we can do a blood test or a stool test instead of having to do a colonoscopy on everybody looking for polyps. Those tests come first. They confirm that there is a polyp, that the colonoscopy is necessary. So I think that's really exciting that we're continuing to find better and simpler ways to screen for colon cancer.
We talked a little bit about this, but the one great thing about Norton Healthcare is the number of physicians that you have, but also, people think, well, I don't have time, Dr. Evans, for a colonoscopy. I'm busy. I work, blah, blah, blah. I've got kids. But tell me about how easy it is to schedule and work it into your schedule.
Well, like I said, it's only one day off of work the day of the procedure because patients will require sedation, and the sedation we use for patients, it wears off very quickly. So you don't have a hungover or drug-like effect for hours on end. It usually is out of your system within 30 minutes, but because we're giving you sedation, we do not recommend patients drive for 24 hours, drink alcoholic beverages, go to work, operate heavy machinery, etc. So as far as scheduling, Norton Healthcare is trying to do a couple of at least one Saturday per month, where if you can't get out of work, we're trying to get patients in on Saturday when they don't have to go to work to help them with their schedules. I know my office and other GI offices and general surgery offices can schedule patients to go and get their colonoscopy in the afternoon. Sometimes that helps with parents taking their kids to school, so on and so forth, and picking them up. So there are options, and trying to work with people as much as we can to get them in if they want to get scheduled.
Yeah, I want to emphasize the Saturday openings, because when I was looking around to get my colonoscopy, that was the one thing that really attracted me to Norton Healthcare, was the fact that, okay, I can go in on a Saturday. It's not going to be disrupting, a whole bunch in my life. I can have a loved one take me and whatnot, and it can be easier. So that was one of the big bonuses that I found with you all.
Mm-hmm.
All right, Dr. Evans, what am I not asking you that you want folks to know about today?
Oh gosh, that is a great question. I would, I think I touched on it a little bit, but I'm just going to try to summarize it for you. Colon cancer is getting, it's not age dependent anymore. If you're in your 20s, 30s, or 40s, it can affect these people of all generations. And I would stress people to talk to their family, know their family history, and if they are high risk, meaning they've had family members with polyps or cancer, talk to their doctors. There are with Norton Healthcare, with the Kentucky colon cancer screening committee. There are websites that you can go to get more information, or talk to your doctor about starting screening, whether it's stool-based test or colonoscopy. Something is better than nothing. I would encourage those that at any age they have symptoms that most of us might blow off or think, oh, I don't want to bother a doctor with that, or I don't want to spend taking time out of my day to go deal with that. That's probably nothing. It's probably a hemorrhoid. Don't worry about it. I would encourage people to be a little bit more not blowing those things off, taking those things a little bit more seriously, because something small like that might be something else. So know your body, listen to your symptoms, know your family history. And then I think finally, learn more about colon cancer and know that you don't just have to have a colonoscopy or nothing. There are other options, and I would encourage people to do that. And the last thing is, again, I'm trying to do this as well. Live a healthy lifestyle, eat more fruits and vegetables, less processed foods, exercise more, drink alcohol socially and not in excess.
All right, perfect. Dr. Evans, thank you so much for all that you do. And as you heard Dr. Evans mention, take the time, learn more about colon cancer. You can do that by going to the link that I shared with you on this stream. Just click on it. It takes you directly to Norton Healthcare. You can schedule an appointment from there, learn more about colon cancer as well. Make that appointment and take your health, make it a priority for 2026. Dr. Evans, thank you so much.
Thank you so much for having me.
All right,
Appreciate it.
everybody take care, and I will see you later here on Wave.